If you want to learn inpatient coding, few important concepts you need to master. Among them, one is CCMCC as well as no CCMCC and APR-DRG. These terms are little bit confusing, but in this session, I am going to clear all your confusion related to CCMCC, no CCMCC as well as APR-DRG. If you want to master these concepts, please watch this video until the end. And also if you like this session, please click on like button. So MCC, CC, no MCC and APR-DRG. So these are the inpatient coding and reimbursement, very important concept you need to understand while coding inpatient charts. So what is DRG? So basically DRG means diagnosis related group. Mostly in inpatient coding or Ipdrg coding, this DRG is the payment classification system. We have two types of DRGs, MSDRG as well as APR-DRG. So in this session, we will speak little bit about APR-DRG. If you don't know MSDRG, please mention in the comment section of this video. I will create one more video related to MSDRGs. So DRG is the inpatient hospital payment classification system. So based on DRG only, hospital will get payment. So how do they divide the DRGs? Okay. For example, if two patients are having similar or common clinical conditions, so they will group those two patients into same DRG using MSDRG or APR-DRG, which will determine reimbursement based on severity. So if the patient is having more severe problems, they will get more reimbursement because of the service provided by the hospital. Next, we need to understand what is CC. So CC means basically complication and comorbidity. Basically, what is complication here? So most of the time, complication occurs due to current to treatment of the active diagnosis. And comorbidity is the pre-existing condition along with the primary diagnosis. So if the patient is having this complication as well as comorbidity, these conditions will increase the patient's length of stay. And also hospital will get more reimbursement. So CC is the secondary diagnosis which will increase the patient's care complexity. So if the patient is having complication comorbidity which will require additional monitoring or treatment to patient as well as it will impact the hospital reimbursement. So most common example for CC is acute blood loss anemia. So as we have discussed, CC and MCC are the secondary diagnosis which will impact the DRG or primary diagnosis. So now we need to understand what is MCC. So basically MCC means major complication or comorbidity. So these major complication comorbidity are more severe than CC or complication and comorbidity. So MCC conditions are serious secondary diagnosis with significant impact on higher resource utilization, greater risk of mortality. And what is the common example for MCC is acute respiratory failure. Okay. Then what is no MCC and no CC? So cases without qualifying CC or MCC. So if you don't code any MCC or CC conditions, hospital will get lowest reimbursement as well as lowest severity level. So in the documentation, if you don't see any MCC or CC, you need to understand that that case is uncomplicated. So in order to provide appropriate reimbursement to the hospital, we need to capture all MCC as well as CC conditions as these conditions will impact the reimbursement. So we'll see one example related to DRG severity structure. Okay. So DRG 470. So here DRG 470 is common for major joint replacement. So with MCC, we have highest payment. With CC, moderate payment. Without CC, MCC, lowest payment. So based on it, you need to understand that what is the importance of CC, MCC conditions. So in order to get or in order to code appropriately, you need to check the complete documentation and you need to capture all MCC and CC conditions. So if you miss any MCC or CC, so it will be a medical coding error and hospital will get lowest payment. So how these CC and MCC impact on hospital reimbursement? So MCC is greater than CC and CC is greater than no CC MCC. So higher severity is equal to higher relative weight. Okay. So basically this higher relative weight affects the case mix index and also direct impact on revenue. So if you don't know about case mix index, please mention in the comment section and I will create one video related to case mix index too. Now we will check APDRG or APRDRG. Okay. So what is APRDRG? All patient diagnosis related groups. So APDRG is developed to classify all patient types, okay, which includes severity subclasses, which we will learn soon. Most of the time these APDRGs will be used by the state Medicaid programs. MSDRG will be used by the CMS mostly. So this APDRG will be used by state Medicaid programs. If you want to know APDRG, you need to understand two concepts. First one is SOI, next one is ROI. First we will learn SOI. So SOI means severity of illness. So in SOI we are having 4 levels. Level 1 minor, level 2 moderate, level 3 major as well as level 4 extreme. So if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. So and also if anyone looking for same day surgery training, IPDRG training, SCC training or CCS certification training, please send WhatsApp message to 707-526-3939. So these trainings will be provided by the most appropriate trainers who are currently working as medical coders in MNC companies. Next, as we have discussed previously, we need to understand ROM. So ROM is risk of mortality. So these are also classified to 4 levels: minor, moderate, major and extreme. So if you want to more information about this SOI and ROM, please mention in the comment section of this video. So documentation and coding importance. So accurate physician documentation is critical, and also as a coder, we need to check the complete documentation in order to capture all CC MCC conditions, as these will impact the reimbursement. Okay. So whenever there is a necessity, we need to query the physician. Okay. As this CC MCC will impact the DRG assignment, always you need to ensure we are capturing all the CC MCC conditions using the available documentation. If we have insufficient documentation, we need to query the physician regarding all this. So thank you team. So as usual, if anyone looking for same day surgery training, IPDRG training, SCC training, CCS certification training, please send WhatsApp message to 707-526-3939. And if you like this session, please click on like button.